In the beginning, there is a question for you. The word rape, is it a legal term or a medical term? What do you think? The word rape is there, no? Is it a legal term or medical term or both? Can you answer in the chat box? Yes, guys. Yes. Have you seen this movie, Euphoria? A very interesting movie. My question is, the word rape is there. Is it a legal term? Is it legally defined? Or it is medically defined? Or it is both? What do you think? So many answered both. Kavita answered both. And Yadusin answered both. Okay. The answer is, the word rape is legal term. It's purely a legal term. It is defined under section 63 BNS, punishable under 64 BNS. With this introduction, let's start. Very important long essay. I said already, define rape 3 marks, 7 description 3 marks, explain in detail about victim examination 4 mark, or 2 plus 3 plus 5 also, that is also fine. It is asked in one of the university exam, especially RGHS exam. Okay. Now, the word rape, it has come from a Latin word rapire. The meaning of that is seize. The actual meaning is carrying of woman by force. As per section 375 IPC, 63 BNS, rape defined as a man is said to commit rape if he, all of you try to understand, a man is said to commit rape if he. So in India, the word rape or the offense rape is limited only to males. The female or woman cannot rape a man as per the section 63 BNS. You can see there it is clearly mentioned a man, not any person. If he. So penetrates penis into vagina, urethra, mouth or the anus. Okay. So the anus, that is known as sodomy. Oral sex, that is known as sin of Gomorrah. Vagina. Now question very commonly asked. What is the common site of hymen tear in case of penetration? Hymen tear. Your answer must be posterolateral. Posterolateral, or it is between 5 to 7 o'clock position on MCQ. The penetration can be a partial penetration, full penetration, even touching labia majora can be rape as per the section 63 BNS. And one more point here is, the medical intervention is not amounts to rape. Yes, so that is about the penetration. Then insertion of any object into vagina, urethra, anus, the mnemonic is VUA. Here it is VUMA. Here it is UMA. Here only VUA only. Insertion. If it is insertion, the most common site of hymen tear is anterior, usually 12 o'clock position. The hymen tear is very uncommon in children because hymen is deep seated. MCQ. Then manipulation of body of victim to cause penetration. Manipulation. Application of mouth into vagina, urethra and anus. So this is the proper definition. Very commonly asked in university exam, you need to answer like this. Penetration, insertion, manipulation, application. The mnemonic is PIMA. So all of you write in the chat box PIMA. So definition of rape, it involves 4 acts. The answer is PIMA. Okay. Guys, come on, try to write PIMA. Then comes is some more MCQ. What is the consenting age? As you know, consenting age is 18 years. Having intercourse with female of age less than 18 years amounts to rape. We call it as statutory rape. Any female, including wife, it amounts to rape. It is known as statutory rape. It is punishable under various sections of POCSO, the Protection of Children from Sexual Offences 2012. The punishment comes under 64 BNS. 64. 63 definition of rape. 64 punishment for rape. The 64 includes even custodial rape also. The 64 divided into 64.1 and 64.2. Again, some more sections that can be asked in your Viva. What is 65 BNS or 66 BNS, 67, 68, 69, 70 and 71 BNS? Very commonly asked. Okay? PIMA? Good. 66 rape and murder. So how to remember? The murder has 6 alphabets. 66 rape and murder. Like example, Nirbhaya case. So what was the punishment given in that? Death sentence was given. 66 rape and murder. 67 sexual intercourse by husband with wife during separation. During separation. So husband and wife living separately. Some court dispute is there. Some marital dispute is there. So both are staying separately. When husband is having sexual intercourse with her without her consent, it can amounts to offense as per the section 67 BNS. How to remember? Husband, 7 alphabets. 7. That is 67 BNS. 68 sexual intercourse by authority. When person having sexual intercourse with the female by using his power, by using his custodial authority, we can say authority, like example, boss having sexual intercourse with the employee, then it can amounts to sexual intercourse and it is punishable. It is not rape. It comes under 68. Again, the punishment varies. 69 with the false promise of marriage. False promise of marriage and having sexual intercourse with the female, then it is 69. 70 gang rape. And 71 is repeat offender. Repeat offender. This is very, very important question, commonly asked. What is 70 I said? Gang rape. 71 repeat offenders. This is again a distinction point you need to write in the exam. Okay. Then types of rape. There are different types of rape. Like example, date rape. Okay. Revenge rape. War rape. Acquaintance rape. Stranger rape. There are many types. You can mention 1 or 2 words in the exam. Different types of rape. One example is statutory rape. Then POCSO, we can mention one or two words about the POCSO. Protection of Children from Sexual Offences 2012. It includes 5 definitions. Penetrative sexual assault, aggravated penetrative sexual assault, aggravated sexual assault and sexual harassment and others. So POCSO 12, there are 5 definitions are there. Can mention one more point about this. Then 7 descriptions, very commonly asked in the exam. What are 7 descriptions? Can anyone tell me? Can I name one description about the rape? Guys, come on, guys. Can I name one description about the rape? There are 7 descriptions are there. So 7 days in a week, 7 descriptions. I'll repeat again. The rape is a legal term. It comes from a Latin word rapere. The meaning is carrying of woman by force. It is mentioned in 63 BNS and also 375 IPC. Now it is outdated. A man said to commit rape if he, PIMA, penetration, insertion, manipulation, application. Consenting age 18 years. Punishment 64 BNS, 64 1 and 2. The punishment can be life imprisonment, 10 years, 20 years, depends on the crime. Again, 66 is rape and murder, 67 husband and wife, 68 authority, 69 false promise, 70 gang rape, gang means more than one, and repeat offender, one person, a person involved in the same crime repeatedly, like example Cyanide Mohan Kumar. Like that. 7 descriptions are there, and also you can write about types of rape. POCSO 2012, there are 5 definitions are there. 7 descriptions you need to mention now, one by one. Diya Sudhir, one description. 7 description, the first one, against her will. When will is not there. See, will means it is interest. The will means interest. The will is formed in higher centers of the brain, especially involves the frontal lobe, emotions. When will is not there, it amounts to rape. Second, without her consent. The consent means permission. So once there is a will, there can be formation of consent. Sometimes there can be no will, but consent will be there. So will and consent both are not same. The will is different, consent is different. Let's discuss with an example in later slide. With her consent, with the fear of death or hurt. With consent under impersonation of husband. Impersonation. In disguise. Okay. Or with her consent under intoxication, like example date rape drug. Or less than 18 years of age, known as statutory rape. Unable to communicate consent. Deaf and dumb, or when the female is unconscious, when she is in coma. So all these are 7 descriptions you need to write in the exam. So this is the definition. Try to memorize this and description. Is it okay, guys? Have you understood this? Any doubt in this? Any doubt? Say yes or no. Yes or no, guys. Good. Good. Diya Sudhir, very good. Diya, excellent answer. Yes, putting pressure without consent. Bahut badhiya. Okay. Yeah. Now I have a question for you. Now look at this. This question is very interesting question. In Indian scenario, only a man can be charged for raping a woman. True or false? Already we discussed in the previous slide. 63 BNS. In Indian scenario, only a man can be charged. Only a male. Male is the offender, not the female. True or false? What do you think? This is a very nice question. True or false? So the answer is true. It is a true statement. Good. Now here is a scenario. Try to imagine a scenario. Here is the boss. The boss is there and employee. So boss using his power by using his inherent property of the power, abusive of the power. So he is having sexual intercourse with the female, with the employee, because she is working under him. So he has a control over her. Okay. So now is it a punishable offense? Yes or no? And what is the BNS section? So boss having sexual intercourse with the employee or with the female by using his authority. What is the BNS section? Try to memorize this. Good. What is the BNS section? Remember 68, authority, authority. 8 is there, no? Authority, authority. 68. Good. Now one more question. Now look at this. Here is the male. Here is the male. The female. False promise of marriage. False promise of marriage. And having sexual intercourse with her. And this man is already married. What is this known as? Or what is the BNS section related to that? Anyone? With the consent here. What matters here is the consent. So consent is there here. If consent is not there, then it is 64(2) custodial rape. If consent is there, it is not rape. It is a sexual intercourse by using custodial power or false promise of marriage. The different sections basically. Okay. Yes. 67. It is 69 BNS beta. 69 BNS. Good. Now look at this. रेप के दौरान मौत होने पर सजा कितनी होगी? What is the BNS section? So try to memorize this along with me, guys. Let's make it interactive. Like example, Nirbhaya case. Rape by 6 people in a moving bus. My question, what is the BNS section? What is the punishment? The punishment is death sentence. The rape is a heinous crime. So answer is 66 BNS. Death sentence. 66. Death penalty. Great. Now, पति के रेप करने पर सजा कितनी होगी? What is the BNS section? The punishment is 2 to 7 years. My question, what is the BNS section? Husband and wife living separately. I said already it is 67 BNS. शादी का झूठा वादा करके, मैरिज झूठा वादा करके रिलेशन बनाने पर कितनी सजा? Your answer must be 69 BNS. Again, punishment can be 5 to 10 years of imprisonment. No need to remember imprisonment, only the section is punished. Gang rape. Gang means more than one. Your answer must be 70 BNS. 70G. Remember the mnemonic? 70G. Gang rape. Now look at this. 6 arrested in minor gang rape case. My question, what are the legal sections applicable to this case? Minor means less than 18 years. Minor can be male or female. It's more than one. It's a gang rape. What are the various BNS sections? applicable to this. See here minor, so it attracts POCSO. POCSO. Section 4. Non-bailable. Section 4 is applicable. Then it is also punishable under 64(2). 64(2) gang rape also comes under 70 BNS. 70 BNS. The punishment can be death sentence. Death sentence in various conditions. One is rape and murder, rape on a female of age less than 12 years, gang rape, or the rape causing persistent vegetative state in the victim, permanent brain damage. In all these conditions, death sentence can be awarded by the court. Okay, yes. Chalo. The next part of the discussion, so that is the long essay, the examination of victim of rape. Medico-legal report on alleged victim or survivor of sexual assault. The better word is survivor of sexual assault, not the victim. It comes under 184. 184. All of you write in the chat box 184 BNSS is equal to victim. Just write victim. Victim of sexual assault. Survivor of sexual assault. Accused 52. Just write 184 victim. 52 accused examination. Now what are the components? What you need to write in the exam? हाँ 63 हाँ दिया सुधीर 63 है ना 63 definition. You know BNS means Bharatiya Nyaya Samhita. It defines offences. It also gives the punishment. 63 definition of rape. 64 punishment for rape. So both are same only. So basically we are we need to remember the punishment. What is the section of punishment related to rape? 64 BNS. 184 BNSS. BNSS means Bharatiya Nagarika Suraksha Samhita. It is related to Criminal Procedure Code. It related to the investigation. What is the procedure to be followed in case of crime, in case of murder, in case of rape, in case of unnatural death, in case of exhumation, in case of dowry death. All this comes under BNSS. So BNSS related to victim examination 184. 196 BNSS, that is magistrate inquest. 194 BNSS, police inquest. So some important BNS sections you need to remember. Yes, chalo ho gaya. Good. Ashley Alien, that's great. Bahut badhiya. So first thing, general particulars. So general particulars you need to take. But remember, identity must not be revealed. It is punishable under 72 BNS. So never reveal identity of the victim of rape to media or any person. Okay, so that is punishable under 72 BNS. 72 minimum punishment is 2 years of imprisonment. Second, inform police in case of rape, in case of murder, in case of any crime. First thing, inform police. Information must be given to the police. Okay, that is your duty as a doctor. So first thing, you can take all the general particulars and never reveal the identity. Then informed consent, very important component. The consent is mandatory. Never examine the victim without her consent. Never ever. It can amounts to some assault. It can amounts to offense. Refusal. When victim is refusing or when victim is not giving consent for the medical examination, medico-legal examination, and also for the sample collection, you can document informs refusal. So now my question is, what is the consenting age for the examination? Can anyone tell me? What is the consenting age? Option 12 years, 14 years, 18 years, 16 years. Yes. H.N. Rajesh and others. Kavita Pava. What is the consenting age for the examination of victim of rape? So your answer must be 12 years. More than 12 years, she can give valid consent for the medico-legal examination. Less than 12 years, you need to take the consent from the parents or from the loco parentis as per the law. Okay, 12 years is the correct answer. 12. It must be informed consent. Okay, some other day we'll discuss about informed consent, what are the components and all. Then identification marks, at least 2 identification marks like mole, scar mark. Presenting complaints like example bleeding, pain. Then we can mention few words about the history of the incident in the case sheet if it is given by the victim. Examination, general examination, general physics examination, then the local examination. Hymen tear is a very important evidence. The hymen tear can be documented with the help of GK rod. GK rod means the Gleister Keen rod, or toluidine blue. So toluidine blue that stains micro injuries. It stains the exposed DNA, RNA. The question can be asked in Viva, what is the use of toluidine blue? Toluidine blue is used to document micro injuries. Also document genital injuries, so abrasions, scratch abrasions, bruises, sometimes lacerations, sometimes defense wounds over the body. You need to document all the injuries. So when injuries are there, that shows there is a forceful intercourse, application of force. Okay. Then investigations, routine investigation, blood investigation. Then the free treatment. The government hospital or private hospital, the treatment must be at free of cost as per 184. Collection, preservation of sample in safe kit. Safe kit means sexual assault forensic examination kit. You need to collect all the important trace evidence, like example any blood stain, a seminal stain, loose hair and all. Then provisional opinion, then final opinion after receiving FSL reports. So all these are the components of examination of victim of rape. You need to write this on the case sheet. Okay, this is what very important in the answer sheet basically. ठीक है, बहुत बढ़िया. So आगे देखते हैं. Now look at this. So what are signs of injury? Signs of injury can be injury to the head, scalp. So there can be black eye. So black eye is a type of migratory bruise. Buccal mucosa injuries, teeth injuries. Abrasions, bruises. Abrasion, bruises are caused by blunt force trauma. Bite mark, so bite mark casting is very important component. Defense injuries, the active defense injury or passive defense injury, again depends on the crime, depends on the incident. Broken fingernail, so the fingernail trace evidence is also very important for DNA. Then specimen scalp hair, blood stain, seminal stain, swab, bite mark basically for that is saliva, DNA fingerprinting, blood sample is taken, any foreign material, urine to rule out date rape drugs, nail scrapings. So 3 marks question can be asked. What are the specimens to be collected in case of rape, especially during medico-legal examination of victim of rape? You need to answer like this. Okay. Now, there is a mnemonic: evidentiary material in suspected case of rape. The mnemonic is clothes DNA. C for clothes, L for lubricant and foreign material, L for any lubricant foreign material, oral swab, toxicology sample like example blood, urine and all, hair, the pulled scalp hair for reference, pubic hair, foreign hair or we can say matted hair, external body swab, swab from the vulva, perineum, thighs, breast area, bite marks, semen or any vaginal, anal, cervical swab, D for DNA reference sample, N for nail scrapings, A for assault injury photograph and documentation, and the bite mark casting. So it's a big list of evidentiary material. If you mention these, that is more than sufficient. So remember the mnemonic close DNA. All of you write in the chat box. The mnemonic related to evidentiary material is close DNA. Just type in the chat box. Collect the evidence as early as possible. Here one more point here, you can see. Collect the evidence as early as possible. Use paper bags, not the plastic bag. The plastic bag can lead to decomposition. Okay, use paper bags. Air dry wet sample before packing. Label every sample properly. Seal, sign and maintain chain of custody. Chain of custody very important to prevent the loss of trace evidence. Then send it to FSL, all the details, everything to the FSL. Then what are the evidence collected from the accused as per 52 BNSS? Clothing, penile swab, pubic hair combings, nail scrapings, blood buccal swab for DNA, urine blood for drugs and intoxication. So, preserve today, prove tomorrow. Every sample matters. So, in case of rape, every evidence matters a lot. You need to collect all the evidences. Yes, guys. Close DNA, Edu, Kavita, all. Okay, great. Now, what is this injury? Anyone identify? Can you identify this injury over the slide, especially over the body of the victim? What are these? It looks like some cuts are there over the back of the hands and the back of the forearm. So this is passive defense injury. So active defense injury commonly seen over the palm, front of the forearm. Then what is this injury? This injury looks like graze abrasion or scratches over the back. Very important physical injury. Now you need to document injuries especially over the face, mouth. You can see the bruise there, the bruise over the buccal mucosa. You can look at this. What are these? What are these injuries? Seems like bruise. Sixpenny bruise. So sixpenny bruise commonly seen over the neck in case of manual strangulation. So they can be seen in case of rape victim also. And I said already, sexual assault evidence collection kit, safe kit. So final report. Look at this now. Now, a question for you. What is the final opinion during victim examination? Abrasion, bruise at the right arm. Abrasion, bruise there on the right arm. Hymen tear is present. Hymen tear on the posterolateral region. Laceration over the thigh. Seems to be blunt force trauma. Semen is also positive. My question. What is the opinion given this particular case? Can anyone answer in the chat box? Anyone? Anyone? So abrasion is there, bruise is there, that shows general violence. Hymen tear is there, that shows sexual intercourse, penetration. Laceration at the thigh, that means local violence. Semen is positive, that shows sexual intercourse. There are many tests for the seminal stain. Barberio test, Florence test, wood lamp examination, okay, Christmas tree staining and all. So what is the final opinion? The final opinion in this case is, it shows there is a sexual intercourse with force. The final opinion here is forceful sexual intercourse, that is penetration. This is how the opinion is given. So this completes the first question, the main question very commonly asked in the exam. Is it clear, guys? Say yes or no? You need to write definition, 375, 63 BNS, consenting age, types of rape, POCSO 2012, 7 descriptions, don't forget. After that, so you can mention the examination of victim of rape, few points here, there, about 72 BNS. There are 10 points in the victim examination. What are the samples to be collected, and how the opinion is given in case of victim examination. So if you mention all this, you will get distinction mark, at least 8 mark out of 10. So all of you guys, yes or no? Yes, finally completed. Darshan Patil. Okay. Chalo. Second question, classify sexual offences, 5 marks question. Classify sexual offences. Sexual offences are classified into natural sexual offences, unnatural sexual offences, sexual paraphilia, and sex linked offences. Your answer must be like this. Natural. Natural means rape, adultery, and incest. Rape, adultery, and incest as per the standard textbook. Mnemonic is RIA. The natural means spino-vaginal intercourse. Unnatural, sodomy, lesbianism, bestiality, buccal coitus. LSBB. Mnemonic, LSBB. Sodomy means anal intercourse. Lesbianism, female homosexuality. Bestiality, having sexual intercourse with animals. Buccal coitus, sin of Gomorrah. All these are unnatural. Then sexual deviations, like example, paraphilias, fetichism, transvestism, sadism, pedophilia. Sex linked offences, like example, stalking, indecent assault. So 5 marks question you can mention like this. Now I have a question for you. The question is here. Look at this. Say example, here wife. Okay. My question is adultery. Is it a punishable offence in India? Adultery. The adultery means sexual intercourse by a male, married or unmarried, with a married female, married to someone. Is it a punishable offence in India? What do you think? My question is adultery. Yes guys, here is the, adultery comes under natural sexual offence. Adultery means sexual intercourse between married female with the male other than the husband. The question is very simple. Is it punishable or not punishable? Answer is not. Yes, very good. So adultery is not punishable. It was punishable under 497 IPC, but it is not mentioned in BNS. But it is a valid ground for divorce, legal separation, divorce. Then one more question, incest. Incest means sexual intercourse between blood relatives, like father and daughter, mother and son, brother, sister, cousin, brother. That is known as incest. So incest can be 3 marks question. It is of 3 types. Oedipus complex, that is father and daughter. Electra complex, that is mother and son. Pharaonic complex, great blood, that is brother and sister. My question, is it punishable, not punishable? Answer is incest in India, it is not punishable. It is not mentioned in any of the BNS. Not punishable. But it is punishable in various countries like UK and other countries. So incest can be 3 marks question. Okay. Now there is one more question for you. It's an unnatural sexual offence. Can anyone tell me what is this sexual offence? Male. So that is known as sodomy. My question again, sodomy with the consent. Is it punishable? Not punishable. Again, answer is not punishable with the consent. Next question is sodomy. One more 5 marks question commonly asked in the exam. Sodomy is also known as Greek love, also known as buggery. It is defined as anal intercourse between 2 men, homosexual, or a man and a woman, heterosexual. The person who penetrates, known as active partner. Active partner. Okay. The person who is penetrated. So passive partner. If passive partner is child, then it is known as catamite. So catamite can be a 3 marks question. The catamite is a passive habitual partner. Passive habitual partner. The types of sodomites, it can be pedophilia, habiphilia, that is with the prepubescent adolescents, epibophilia, post-pubertal adolescents, gerontophilia, that is with elderly people, gerontophilia, gerontophile. Again, the question can be asked, what is janana, what is hijra? So they are basically known as male prostitutes. In janana, genitalia intact. In hijra, genitalia is not intact. The medical legal importance, it is not punishable when it is between the 2 adults with the consent. But when age of the victim, age of the passive partner is less than 18, it is punishable under POCSO Act, Protection of Children from Sexual Offences. And sodomy, act of sodomy, can be valid ground for divorce as per section 13 of Hindu Marriage Act. Again, when less than 18 years or more than 18 years without consent, it amounts to rape. We discussed in the beginning. The definition of rape has 4 components: penetration, insertion. So insertion of penis into even anal canal amounts to rape. Okay, sodomy is 5 marks question. Catamite is commonly asked. Then sexual paraphilia, very commonly asked. So 3 marks question. So there are various types of sexual paraphilia. One is voyeurism, exhibitionism. Voyeurism means observing an unsuspecting person who is naked or disrobing or engaging in sexual activity. Peeping Tom, basically it is known as peeping Tom. Exhibitionism, exposure of genitals to an unsuspecting person. It can be 3 marks question. Again, exhibitionism can be of 3 types. It can be flashing, streaking, aneurysma and all. Voyeurism, that is known as toucherism, also known as chikan in Japan, touching or rubbing against the non-consenting person. Then sexual masochism, that is sexual pleasure, sexual gratification. So when being humiliated, beaten or bound. Sexual sadism, physical and psychological suffering. Pedophilia we discussed. Fetichism is non-living objects or non-genital body parts. Transvestism, that is cross-dressing. So this can be a 3 marks question in your exam. Good. Now we need to identify one by one. You must have seen this movie, a Drishyam movie. So what is the sexual paraphilia? The paraphilia characterized by, taking image, taking photo, taking video of the victim while using lavatory or while using any, while changing dress. What is that known as? Anyone? And what is the BNS section for that? I've seen this movie, guys. Very nice movie. So this is classical voyeurism. 77 BNS, also known as peeping Tom. ठीक है, peeping Tom. Okay. Second, this is also same, peeping Tom. Peeping Tom. Exhibitionism. What are the different types of exhibitionism? So this is aneurysma. Okay. So mooning, flashing, streaking. Streaking. Can anyone identify what is this sexual paraphilia? Sexual paraphilia common in crowded places, buses, metro trains. What is this paraphilia? One by one. Come on, guys. Lion, Yadusin, Kavita. So this is classical proteurism. Proteurism. Okay. Then I said this is masochism. Sadism. Pedophilia. Okay. Now let's discuss few MCQs. Some prof exam MCQ commonly asked in the exam. Yes, come on. Come on guys, are you there? Shall we start MCQs? Are you there guys? Kavita Pawar, Yadu Singh, Rakesh, Rajesh, Rakesh, are you there? Okay, chalo. First question. So this is asked in one of the exam. A 24-year-old man gets married with a 16-year-old female. Having sex with her will be considered as rape if case is filed within 1 year of marriage because no consent taken from wife age less than 18 year, wife age less than 21 year, wife age less than 17 year. So here it amounts to rape. Why? Because age less than 18 years. It is statutory rape. Next question. Husband had intercourse with wife during judicial separation without consent. Section which deals with it. Try answering guys. Okay. The first to answer by Akash. So Akash, good answer. Husband had intercourse with wife during judicial separation without consent. Section which deals with it. 63 definition of rape. 66 rape and murder. 68 authority. So the answer is C. Very good. Rajat. Good answer. Most common position of hymen tear in a virgin girl. Most common position of hymen rupture. The answer is posterolateral. The instrument used is GK rod. The hymen tear is very uncommon in children because it is deep seated. Good. Posterolateral. You need to write the question number, okay? 3 answer like that. 3 answer A, B, C, D. 3 C many answered. Good. Statutory rape is rape of an insane woman. That comes under 64(2) BNS. Rape of another person's wife, that is 64 BNS, 64(1). Rape in police custody, that is custodial rape, 64(2) BNS. So the answer is fourth question, less than 18 years. Less than 18 years. Oh, good. The first answer again by Rajat, and it's okay. Akash, good. Good. Many answered. The most important legal element in rape under section 63 BNS. Most important legal element in rape under section 63. Injury, summon, consent, witness. Right? Fifth question. So the answer is consent. Consent is most important. So answer is C. 5C. Good. Now, this is one more very interesting question. A 32-year-old married woman is brought to hospital by her husband who alleges that she had a sexual relationship with the consent with another man. So it's a case of adultery. He requests the forensic expert to certify that his wife has committed adultery so that criminal proceedings can be initiated. The woman denies the allegation, refuses genital examination. The forensic expert explains the current legal position in India. Which of the following is the most correct regarding adultery in India? Adultery is a cognizable criminal offence punishable with imprisonment. Forensic expert can certify adultery by genital examination alone. Adultery is no longer criminal offence in India but may be ground for divorce. Husband can compel medical examination of his wife to prove adultery. Question number 6. What would be the best answer? So, cognizable offence means the police can arrest a person without warrant. So, it is not a cognizable offence. Okay. Answer is, it's no longer criminal offence in India, but may be a ground for divorce. C is the best answer. C. 6C. Now, next question. A 30-year-old unmarried man is arrested for repeatedly stealing women's undergarments from a hostel. So, undergarment thief. During psychiatric examination, he admits that he becomes sexually aroused by possessing and by handling the garments, has no intention of selling them. He has no history of psychosis or intellectual disability. So he gets sexual gratification by stealing undergarments, that is, inanimate objects, non-living things. Which of the following most likely diagnosis? Voyeurism, already said it's a peeping Tom. Not the answer. Proterism is toucherism. Not the answer. Voyeurism is 77 BNS. Proteurism, okay, not the answer. Exhibitionism, the best answer is B. B is the correct answer, 7B. So the first answer by Akash again, Darshan Patil. Now, this is a very interesting question related to impotency. So, try to read this question and try to answer. 24-year-old unmarried man visits the psychiatric clinic with the complaints of generalized weakness, fatigue, poor concentration, anxiety for past 6 months. He believes that passing a whitish fluid in the urine, occasionally natural emissions, have caused him to lose his vital energy. What is this known as? On physical examination, hormonal profile, neurological examination are normal. That means it is not vascular impotency or it is not organic impotency. It is not organic impotency. It is basically psychological impotency. Hypogonadism, no, not the answer. Peyronie's disease, no. Fibrosis, no, not the answer. Organic erectile dysfunction caused by either vascular cause, neural cause, drugs and others. The best answer is Dart syndrome. Answer is Dart syndrome is the correct answer. 8th question. Rajesh is first to answer. Very good. Rajesh. Good answer. Then the 9th question. Look at this question and try to answer. Here is a case of loss of sexual interest, or we can say involuntary spasm of perineal muscles, narrowing of introitus, making penetration impossible. One of the cause for female impotency. The word impotence is applicable to males. So it is basically frigidity. Frigidity. The word frigidity along with involuntary spasm, the answer is vaginismus. A is the correct answer. 9A. Good. The last question. A 22-year-old woman is brought to the emergency department alleging that 3 men sexually assaulted her during the same incident. She is conscious. Examination initiated after obtaining informed consent. Which of the following is the most important forensic principle during evidence collection? Delay examination until police arrive. Collect specimen only if visible injuries are present. No. Start examination as soon as possible. Evidence is very important. Collect specimen in any case, visible injuries or no injuries. Maintain proper chain of custody for all collected evidence. Obtain a confession from the accused before collecting samples. The best answer is maintain proper chain of custody. C is the correct answer. 10 is the C. Okay. Now, one more very commonly asked question is MTP Act. So after the session, we just go through MTP Act. So what are the indication? What are the rules, MTP rules and all. Very important question. One more commonly asked question is 6th question after the class. Go through impotency. Impotency can be a 5-mark question. Then 7th question commonly asked is infanticide. Infanticide. Ragot test commonly asked. Then child abuse. Child abuse can be a 5-mark question. Then comes is seminal stain. Seminal stains. So it can be 5-mark question. Sometimes the question can be asked about pregnancy. The medico-legal importance of pregnancy. What are signs of pregnancy? Okay. So 10 important questions very commonly asked in the exam. Now I have a video question for you. Let's see about the Ragot test. Yes, here. So Ragot test is also known as hydrostatic test. It is done in case of infanticide. If lung pieces are floating, then it is live birth. If lung pieces are sinking, then it is stillbirth. Again, there are some conditions which are leads to false positive. There are some conditions leads to false negative also. Now look at this video and identify a case of newborn death. My question is it a live birth or a stillbirth? So here are the lung pieces which are kept inside the container. You can see here, they are floating. They are floating. That means specific gravity less than water. That means there is a air within the lungs. My question is it live birth or stillbirth? Right. Yeah. Stillbirth. So some are telling stillbirth. Why? Lung pieces are floating. They are floating, no? Floating means live birth. Sinking means stillbirth. The control here used is liver. Once again, observe this video. Yes. Okay. Anil Kerale. You can also see here the liver also. Look at this now. The right and left lung, they are floating. This is liver. Yes, you can see here liver. So the liver is sinking, lung pieces are floating, or lungs are floating. What is your inference? We can make out now, I think, this point. Now, Anil Kerale. Now you tell me, guys, is it live birth or stillbirth? It's a case of live birth. Okay. Then some image-based questions. Yes, last 5-10 minutes, guys. Let's discuss 10 image-based questions. So this is the first image-based question. A case of rape. The sample was taken. The sample was mixed with the picric acid. On mixing with the picric acid, there is a formation of spermine picrate crystals. Spermine picrate crystals. Can anyone identify what is this test? This test is a test for seminal stain. Yellow needle shaped crystals. Your answer must be, it is a Barberio test. Barberio test. So Barberio test, Florence test are commonly used in identification of seminal stain. So this can be a 3 marks question. Barberio. Good. So there are different tests. 3 marks question. Acid phosphatase, Barberio, Florence test, Christmas tree staining, PSA P30, DNA profiling. Acid phosphatase is the best screening test which gives rise to purple color. Barberio, spermine picrate crystals. Florence, brown rhombic crystals. Christmas tree, a red head, green tail of the sperm. In case of azoospermia, we can use PSA P30. So DNA, that is basically V and TR to identify the accused. So this can be 3 marks question. Yes. Anil Kirale, Kavita Pawar, Rajat MM. Is it okay? Are you able to answer 3 marks question? Yeah. Then, types of hymen. One more very important 3 marks question. What are different types of hymen? So, this is one central opening, that is basically known as annular hymen. Multiple opening, cribriform. 2 opening, septate hymen. No opening, imperforate. Imperforate. ठीक है? So this can be 3 marks question. चलो बढ़िया, आगे देखते हैं. Now the next clinical scenario. During examination of a child, the findings are subdural hemorrhage. So there is a subdural hemorrhage below the dura mater, a retinal hemorrhage, and encephalopathy. Encephalopathy. What is this condition known as? A case of child abuse, a suspected case of child abuse, non-traumatic injury caused by violent shaking of the baby. What is this condition? Subdural hemorrhage, retinal hemorrhage, encephalopathy. Your answer must be shaken baby syndrome. Shaken baby syndrome. 3 marks question. SBS, shaken baby syndrome. Good. So all of you write in the chat box SBS. SBS. Keep writing few points in the chat box so you can interact with me. You can keep yourself awake and myself awake in the class. Guys, come on. Yes, Anil Kirale, great. Good, Anil. That's great. Now, one more very interesting picture there. Here is the condition, a 3 marks question. Twin pregnancy, same age. Twin pregnancy, same age. Different father. Same age. Different biological father. You can see here, what is this condition known as? Remember, this is a classical case of superfecundation. Superfecundation, superfetation can be a 3 marks question. Difference between superfecundation and superfetation can be 5 marks question. Try to memorize this. So after the class, go through this table. Superfecundation, same cycle, same age. Fetus after fetus, that is superfetation, it is very rare. You can go through this after the class. Good. Yeah, okay. Now look at this, one more question. The question is pink feathery crystals. It can be a spotter in your forensic exam. Blood stain, related to blood stain. The suspected blood stain is taken. It is mixed with a reagent. The result is formation of pink feathery crystals. What is this test known as? There are many tests are there for blood stain. Takayama test, Teichmann test, 3 marks question. Takayama and Teichmann. They're basically hemine crystal test. When hemoglobin binds with the reagent, it forms hemine crystals. That means that is a confirmatory test for blood stain. When pink feathery crystals, your answer must be Takayama test. You can remember Takayama, Takamama, pink feathery crystals. Teekman test, brown rhombic crystals. So all of you write in the chat box. Takayama, pink mama. So mama is pink. Takayama, pink mama. बहुत बढ़िया. Okay. Yes, so this almost completes today's session. I hope you understood. I'm going to share all the images, all the important questions after the class. If you have any doubt, you can ask me for next 5 minutes. Yes, Darshan Patil, Kamita and all others. Any doubt?